asam laksa,
Menyenangkan.
satu nama,
Salad. Favorite food is durian.
Outdoor activities.
Fun games.
party, food telling lada,
Seronok.
Dance.
Gardening.
Sakit dan kematian.
Loneliness.
Fear to have pain.
Uncertainty.
not in my vocabulary.
Fear of getting sick.
My family.
Love for my husband.
Family.
Keluarga. Saya suka menari.
Sleeping.
We get very little time as mothers to rest.
Change. Hope.
Acceptance. Nambike. Bersyukur.
Keberanian.
Acceptance.
Faith.
Beautiful life after this.
Start a fire as we pray.
Everyone in the video had cancer. However, cancer wasn't the end for them. They are still going strong with the courage, hope, and dreams they have. They overcame uncertainty with the love from the society. So, what is cancer? Cancer is a disease of an uncontrolled development of abnormal cells in the human body. It can cause a big change in one's life as it affects both the patient's physical and mental health. It creates a complex feeling that the patients may be unfamiliar with. Cancer patients may have mood swings each and every day, hour, or even minute. Hence, it is very important for patients to avoid having any other undesired emotions. Having said that, the support of family, friends, professionals, and the society would mean a lot to them as it provides them with an increase in strength and courage to cope with cancer. Similarly, they feel less lonely on the road to recovery. According to credible statistics from Our World in Data, in year 2017, 9.6 million people are estimated to have died from various forms of cancer. This means that every 6th death in the world is due to cancer, making it the second leading cause of death. As a matter of fact, the number of deaths caused by cancer have been increasing from year to year. Have you ever wondered how each of you out there could help cancer patients?
Based on everything we have just said, this brings us to the introduction of the organization we are going to mainly address today, MAKNA. M-A-K-N-A, MAKNA, also known as the National Cancer Council of Malaysia, is a non-profit organization that was established in the year 1994. So who is the myth? Who is the legend that started this organization? Let us all find out. On the screen right now, also known as Dato' Muhammad Farid Arifin, is the founder of the organization MAKNA. He got the inspiration from his son who had fought and struggled with cancer in the past. The organization provides services such as cure, prevention, research, and support to cancer patients and their family members regardless of their personal background. Every year, MAKNA provides help to at least 100,000 cancer patients. This is equivalent to helping approximately 28 patients per day. The variety of help include oxygen concentrator for the patients, surgical items for surgery on the cancer patients, scholarship for cancer patients, and many more. So what is the mission of MAKNA? To mobilize resources in order to provide curative, preventive research and support services to cancer patients and their families, high-risk groups and the general public in Malaysia and the region. This is to ensure that all cancer patients in Malaysia receive the medical treatment and care they require through the journey for recovery and to fight against cancer.
According to Japanese traditions, a person who receives 100-folded lucky stars can make a special wish upon the stars. Therefore, we have voted 1,000 stars for 10 cancer patients. We hope that the gifts would be a symbol of hope for the cancer patients and the receivers would be granted with good health and happiness.
If you ever find yourself stuck in the middle of the sea, I'll sail the world to find you. If you ever find yourself lost in the dark and you can't see, I'll be the light to guide you. Find out what we're made of when we are called to help our friends in need. You can count on me like 1, 2, 3, I'll be there. And I know when I need it, I can count on you like 4, 3, 2, and you'll be there. 'Cause that's what friends are supposed to do, oh yeah. Ooh, ooh, yeah, yeah. If you're tossing and you're turning and you just can't fall asleep, I'll sing a song beside you. And if you ever forget how much you really mean to me, every day I will remind you. Oh, find out what we're made of when we are called to help our friends in need. You can count on me like 1, 2, 3, I'll be there. And I know when I need it, I can count on you like 4, 3, 2, and you'll be there. 'Cause that's what friends are supposed to do, oh yeah. Ooh, ooh, yeah, yeah. You'll always have my shoulder when you cry. I'll never let go, never say goodbye. You know you can count on me like 1, 2, 3, I'll be there. And I know when I need it, I can count on you like 4, 3, 2, and you'll be there. 'Cause that's what friends are supposed to do, oh yeah. Ooh, ooh. You can count on me 'cause I can count on you.
We have invited the healthcare workers of Magna to join our interview.
Good afternoon, Mr. Cheryl and Mr. Norman. Thank you for allowing us to interview you. Before we start, can you introduce yourself?
My name is Sharil, and I'm the communication executive for Magna. And for today, the one that you'll be interviewing is my friend, my colleague, Norman. So Norman is the staff nurse and also the exhibition executive for Magna. You want to say something?
Hi.
Hi.
I'm Numan, staff nurse of Magna. I'm also in charge of exhibition, talk, and cancer awareness of Magna lah.
Let's start with our first interview question, which is, based on past experience, what is the first basic reaction from cancer patients when they first knew that they have cancer?
Death is the major thing. Okay, it is a death sentence. Having cancer is a death sentence. That's number one. But actually, these things that I'm going to tell you actually is the myth actually. Why? If it was detected in stage 1 or stage 2, the survival rate for most of the cancer is up to 80%, 90% survival rate for 5 years. Okay, but if it was detected at the later stage, which is a stage 3 or stage 4, the survival rate for stage 3 and stage 4 will be less than 40% instead. That's the survival rate. But cure rate for stage 3 and stage 4, okay, we can say is almost none. So that's the perception. Number one is death. Okay. Number two, when a patient, you know, have the news that they had a cancer, is always about the cost. Okay, that's why Makna came in, because the cost of cancer treatment was very, very, very expensive. If you get a treatment from private hospital, okay, it costs you, for basic treatment, it costs you about 100,000 to 150,000 per year. But if you go to the government hospital, each treatment patient have to pay for about 50 ringgit. Okay. Number two is our cost. That's only for treatment. We also had a lot of extra costs, such as transportation costs. You know, we only have 7 cancer centers in Malaysia. So we have in Penang, we have in KL, Putrajaya, Johor, Kelantan, Sabah, and Sarawak. So if the patient was in Perlis, so he or she have to travel to Penang. So these are additional costs that patient have to think about. Okay, the next thing is cancer cause pain. Okay, this is something also that open to doubt. Okay, first, stage 1 and stage 2 cancer will not cause any pain. Okay, but if the patient was detected in stage 3 or stage 4, usually it will cause pain, and it will be the most excruciating pain that patient will ever had. Okay. And apart from that, we also have some myth about, cancer treatment was very cruel. You know, we've seen a lot of drama. So we have been, having this thought that cancer treatment is very, for example, is very hard. Actually, it's not. Okay, cancer treatment is really, 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 really easy. So with this kind of myth and thoughts, okay, patient might have these negative feelings, when they had a news or they was diagnosed with it. For example, they feel sad, they feel hopelessness, okay? And apart from that, it's not only the patient, but also the family members as well. It's affect not only the patient, but their surrounding people.
What is the most important thing a cancer patient needs in the journey towards recovery and to fight against cancer?
This thing I usually advise in 2 perspectives. Number one is the patient itself. Okay, we always have to advise patient to work closely and work as a team with the doctor. Okay, don't ever listen to all these myths, because when you have a cancer, usually people will come to you and say, okay, eat this product and you do this, go for alternative treatment, don't go for modern treatment. No, it's not. Okay, we always advise patient to work as a team. Even you want to try alternative treatment as well, you can still discuss with your doctor. That's number one. Number two is that the patient, okay, if you learn the basic thing of psychology, we have basic concept which is the concept of grieving. Okay, we have a few stages of grieving. Usually, when patients achieve the acceptance phase as much or as fast as possible, everything will be easy for them. So usually, we have to determine which phase currently are patients in. So we help them in achieving the acceptance phase as fast as they could. And then we always advise patients to be patient, okay, sabar, or to stay positive, because these are the things that they need for, throughout the journey of battling the cancer. That's for the patients. Number two is for the caregiver. Okay, it's also quite challenging for the caregiver, which is their family, their surrounding people, because number one, patient might have some emotion roller coaster, which is the emotion quite unstable. Okay, like I said, sometimes they'll be in denial, sometimes they'll be in depression, in anger state. So this will affect the caregiver as well. So caregiver have to be patient as well as to give more moral support to the patients. So I always advise to the caregiver that it's okay to have a me time, like 1 hour a day or like once a week. It's okay to have that. So these are the things that we always advise our patient to equip them to go through this cancer journey.
Moving on to the next question, which is, how can students like us with limited or no income do our part in helping cancer patients?
As a student, okay, for me it's quite simple, okay, because we know that students is quite limited, especially in terms of financials and everything. Usually I advise them, number one, you can be a volunteer. For example, you can be Magna volunteer, for example, because Magna have a lot of activities that you can join. For example, you can join, at first we give you the training, and then we bring you into our activity like home visit. We go to our patient's house, because every patient that we help, we go to their house and to see the needs that they needs already arrived to them, something like that, or any other needs that they require. So these are the things that we do with our volunteer. Apart from that, we also bring our volunteer to join our awareness event, our screening program. There's a lot of things. That's number one. Number two, if you don't want to be a volunteer, another thing that you can be is to understand cancer patient. Okay, it's not necessarily a cancer patient that you don't know, but it can be your family members, it can be your friends, something like that. So in what way you can help them is very easy. Listen more, okay, and don't talk too much, just listen, and try to take care of your words. Sometimes your words might be normal for us, but it's hurt for cancer patient. For example, I give you very simple. We always say to cancer patient that, oh, we understand. Actually, it hurts them. Why? Because we are not a cancer patient, so we don't understand them. So these are the things that we can do. Okay, apart from being a volunteer, doing all these works.
Amazing.
Yeah, apart from that, if you join us or become volunteer or something, you can raise fund. And then can give to a certain NGO like Magna or the cancer NGO as well, for us to help us to help our patients.
What is the role of public in helping cancer patients? Do you have any suggestions?
There's a lot of things public can help in helping cancer patients. Number one is of course, donations, because as I said before, cancer treatment was very, very, very expensive, especially to the B40 communities. 50 ringgit for us is like 2 times KFCs, for example. But for B40 communities, it's the whole week meals. Okay, so public can give donations. That's number one. Number two, like I said before, if public had, for example, you had that have cancer, you can help them. It's not only for moral support, but also you can help them in, for example, in resourcing. Okay, for example, if their child or their children, it is same school with your children, so you can help them. Maybe you can pick up both of them together, something like that in resourcing. So these are the things that public can do in helping our cancer patients.
Finally, do you have any final words or advice which you would like to give to the public?
Actually, there's a lot of advice that I want to give to the public, because it's not only to the patient but also to the public. To the public, number one is adopt a healthier lifestyle. You don't need to go vegan or whatever. It's good too, but you don't need, but adopt a healthier lifestyle, like exercise 150 minutes per week, eat healthy, eat moderately. Okay. Number two is early detection. Okay, even though we do all these healthy lifestyle things, but we still at risk. So know how to detect cancer early. Okay, do your monthly breast self-examination, and for men, your monthly testicular self-examinations. Okay, and also for women out there, know what are the screening available at our government clinics or hospitals. Okay, that our government provide it for free. And towards cancer patients, I always advise them to stay strong, stay positive, and it's very easy if you in Malay we always say reba. If in English we say acceptance. So if you reach this phase, as fast as you could, everything will be easy.
Mr. Sharil and Mr. Noman, thank you for your cooperation. We appreciate it that you could find the time to give us this opportunity to interview you all. Thank you and have a nice day.
Kata-kata semangat lah dekat sini. So, saya serahkan Kak Cik lah.
We will always support you.
Kata-kata semangat lah untuk Allah. Terima kasih lah.
We will always support you.
College, diorang buat assignment. Okay, diorang buat assignment. Tapi diorang tak ada duit lah nak bagi barang ke kan. So diorang buat wish star. Lepas tu dia put the positive word up here. So I hope Uncle okay
Okay. Dah. Dah video ya. Dah.
We will always support you.